It's Tuesday, the day we answer your medical questions, and joining us this week is Dr. Adam GRISAK, and we are answering a question sent to us from Janice in South Cumminsville. Is Nettle tea good for hot flashes? If so, is it safe to drink if you have hypertension?
So, doing some research and talking with my colleagues, there wasn't a whole lot of medical evidence out there for Nettle tea and hot flashes. What we did find with Nettle tea is that there has been some recent evidence that there is benefit for people suffering from rheumatoid arthritis.
Okay.
Some older men get enlarged prostates and they can have urinary tract issues. Adding Nettle tea or Nettle extract has shown benefit, as well as some people and the study was specifically for the base of the thumb, joint pain. They found that adding that Nettle extract to a topical application did give some benefit. Now, however, those studies were small in how many people were involved, so the recommendation was that more research needs to be done for that. Now, going back to using Nettle tea for hypertension, like
right.
affected, good or bad, there is no contraindication to do that for hypertension.
What can people do to improve hypertension?
Well, hypertension is something that affects roughly 50 million people in the United States.
Wow.
It's a pretty serious disease, and most of the time there's no symptoms. So that's why it's important to see your doctor at least once a year, because as you age, things change. You're not the same person you were when you were 12 as you are today. So seeing your doctor, your nurse practitioner, they will measure your blood pressure, check some screening labs. First thing they could do, if you don't want to do any medication, is lifestyle change. That one being what's called the DASH diet. That's stands for the Dietary approach to, let me see here, I forgot. Dietary approach to stop hypertension. What that involves is changing around some of the food you're having a lot more vegetables, having a lot more fruits, lean meats, low-fat dairy foods, exercising. We're not talking about going to the gym being like Arnold Schwarzenegger, but we're talking about walking for 30 minutes at a time.
Small changes that we need to do every single day.
Absolutely.
Doctor, thank you so much for being here. And remember, the answers you hear from our TriHealth experts are just a good place to start. This is not a replacement for advice from your own doctor. And as always, please send us your medical questions and a TriHealth doctor will answer it live on the air next Tuesday. Just look for the link at wcpo.com/doc on call to submit your question. We will answer one question every Tuesday. We'll be right back.